I'm Dr. Jayanthy Ravindran. I'm a board certified plastic surgeon. So I specialize in aesthetic work, both surgical and non-surgical. So as we are talking about your skin, so now all of us would like to identify what skin type that we all belong to. So the simple step, wash your face well with just normal water after a good day of rest. Leave after you wash and dab dry, leave it for about an hour's time. Then take a blotting paper or just a tissue paper, and then you'll have to test the quality of your skin in different zones. So we call the T zones, which is the forehead, the lower forehead, your nose, and a little bit of your chin. So take two different tissue paper. First, try the wipe the T zone well a couple of times, and then look at the tissue paper. If it is whether it has got oil in it or it is normal, and also look at after you did this couple of times, look at your skin, whether there is any abrasion or it looks dry, there is some scale. So this will tell us if the tissue paper has oil in it, then that zone is oily, and if it doesn't have its clear, then it's a normal skin. And if you feel after that, you look at your skin, and as you do it, you feel mild scaling or it is blush, then you look at it's a dry skin. So most of the time, we usually have combination skin. That is because we have more sebaceous glands in the T-zone area. So there are more pores there, and these pores are active. So usually the T-zone is oily compared to the rest of the zone. But generally, we can have a normal skin if you use the right cosmetics and you follow the right steps. So this is very important for you all to understand when you choose a product. So when I say it's a sensitive skin, now the skin barrier has been lost. So it reacts quickly because whatever you apply, it immediately goes inside, triggers an inflammatory response, and you start reacting. So if it's a sensitive skin, you'll have to give 6 to 8 weeks time, rebuild the skin, then it becomes a normal skin. After which you can have products that you can apply to a normal skin. It's not necessary that you will have to apply products that are specifically meant for sensitive skin. So this is very important for you all to identify what skin types. And remember again, we do not have the same skin type all throughout our life. So obviously, your products also change. If there is some, like you might be using some products and you never developed any acne. Suddenly you will think that I've started developing acne, and you might contribute that to some procedure or something. We don't know. So we'll have to evaluate and see why the change happened. It could have been that you have complete stress at work, and that triggered off stress hormones, and that actually triggered off activity of the sebaceous glands, and then they became oily and so you start erupting. So the various things. Now, as I was talking about blue light, again, there are various papers which says blue light creates an inflammatory response. There is oxygen-free radicals that's released. Then there is this damages the skin, and the skin barrier function is lost. Then the skin becomes sensitive. So first, identify your skin type at that particular time, and then choose products that are relevant. And suppose that doesn't work after a period of time, retest and see what's gone different, and then choose the product accordingly.